Good morning, everyone, and welcome to County Executive Stuart Pittman's weekly media brief. I'm Roz Hamlet, PIO in the County Executive's office. This morning, the County Executive will kick us off with his report, and he will be followed by Dr. Nilesh Kalyanaraman. Thanks very much. Stuart?
Thanks, Roz. Case rates are continuing to decline. We're 7-day average of 14.1 per 100,000 population new cases. Turn off my phone, sorry about that. We are up to 528 lives lost in Anne Arundel County to COVID, including the 14 who were not tested. Hospitalizations, however, are declining, and so things are looking good on that front, and you can expect an announcement in the coming days about some additional movements on restrictions in the county. We're pretty close to what the state standards are, but there are a few loose ends that we'll be tying up with an executive order in the coming days. So we'll let you know when that's ready to go. I think last night I talked about the overall numbers of vaccinations, vaccine doses that we get in Anne Arundel County, and some of the 5 requests that I and my peers in the counties across the state have made of the governor. One was to give us the numbers so that we could make sure that doses are being distributed according to population. And we do have a pie chart that we got from the state. Jenny, could you put that up? Yeah, thanks. So this shows us, you may remember last week that 4 counties, Baltimore City, Howard, Montgomery, and Prince George's had data like this presented, and the governor's office said that they would have by the end of last week for all counties. And I understand that they're still working on that, but they did give us this on Saturday when we requested it. And it does show us that our local health department is getting most of the doses in our county, which we've been getting 3,400 a week. So they gave us a 2-week summary here. So that gives us 6,800. And then our hospital's getting about 1/8 of that, 10% of the total. And our, they call it transfer pharmacies here. These are the pharmacies that are not part of the long-term facility program with CVS and Walgreens that the feds have created. Mostly Giant, those have gone to, or all Giant according to this, 800 in 2 weeks. That's 400 per week on average. So you can see that our pharmacies are not a place where a lot of vaccinations are going, nor are our hospitals. So I'm concerned about the number of doses. We want to increase that. It appears that, you can take the slide down now. Thanks. And we can get that to people if they want it. I assume the state will be putting these out for all counties very soon. But it appears that more doses will be going to the mass vaccination sites. We know that they've said that 2,000 a day are being administered at Six Flags, and that they expect to be at 2,000 a day at M&T Bank Stadium. They open on Thursday, and they'll be at that level very soon. And that's great. We wish that it was a little closer. We would love to have one in our county, of course, but we encourage our residents to sign up for those doses, because it does appear that that's a strategy that the state is moving towards. We hope that we won't lose any doses in the county as a result of that effort. But we know that the total numbers of doses coming to Anne Arundel County are going to be increasing eventually, and we're going to need all these sites, and we're going to need every system we can to get doses out fast when we get to those levels. So we're pleased about all that. The state has created a pre-registration system. This was one of the requests that we had made, so that people would not have to sit and wait until there was an opening and keep refreshing the site till there was an appointment available. It will be set up so people can pre-register, and then when there's doses available, they'll be notified, and then they can get appointments, as in Arundel County, most counties do. So it's great to see the state is implementing that as well. We still wish that it were one central site so that folks didn't have to go to each pharmacy and each hospital and each local health department, as well as the state site. But it's a step in the right direction. Our COVID Vax pre-registration site has 121,365 people on it. As we take them off, more are added, and it's working efficiently. One of the good things about it is that our staff helps folks who can't work through an electronic system very well. So particularly our seniors. And I really do have to, I always do this, give credit to our departments and the hard work they're doing. But when you think about it, there have been 13,114 calls returned from people who need help getting registered for a vaccine. So this is a major program, and it's involved people from our Department of Public Works, Central Services, our library system, our social service agency, Office of Plan and Zoning, Office of Emergency Management, our community engagement and constituent service staff, bilingual staff that have brought in to help. And I can tell you that if we didn't have these folks working on this, the only folks getting vaccinated would be folks who are good at surfing the internet. So thank you to all of them. The way it's working right now is that all calls and voicemails are being addressed on the day, if it's a weekday, that they're received. We got behind a little bit, but we're caught up. And then weekend calls are logged over the weekend for return calls on Monday. In terms of equity and vaccination doses, I think Dr. Kalyana will probably have more to say on this, but I do want to just congratulate the health department and the equity team of residents that have been meeting on this. We have a system, as you know, where the random selections for appointments from our pre-registration reflect the demographics of the county, computerized system. We have locations that are going to be opening up, one on Thursday at Lula Scott in Shadyside Community Center, and one on the weekend at O'Malley Senior Center. Not sites where people can go to get vaccinated without an appointment, but locations where people that are getting pre-registered, that have been pre-registered, are getting their shots, so that there are places closer to home for people. And then there will be community vaccination sites, and Dr. K may talk more about this. That'll be starting up in March. Marketing plan being developed, and I want to note that our Youth Advisory Council that we created to advise me on issues is actually serving as a focus group for a Hatcher group of consultants that's helping us with our marketing plan to get particularly underserved and minority communities signed up for vaccinations. So they're going to be doing that at their meeting on Thursday. People can get information and log into that if they want to attend our Youth Advisory Council meeting. March 1st is a community conversation addressing vaccination issues in minority communities, and it's being conducted by the Health Department and the Equity Committee in honor of Robert Eads, who lost his life to COVID after working very hard in the community to try to encourage others to get tested and to protect themselves. Unfortunately, 8% of our population is Hispanic, but only 3% of our folks being vaccinated have been Hispanic. 18% of our population is African American, and only 10% of the folks having gotten vaccinations so far are African American. So we have work to do to catch up with those numbers. I want to announce a few things that are coming up. You will be getting a press release, I believe, later this week, maybe possibly even later today, with a new program that's called the Renter Eviction Avoidance Program, REAP, in cooperation with HACA, the Housing Authority of the City of Annapolis. It's being administered by our Anne Arundel Community Development Services, and it is to help the 300 plus people who you may have read about, residents of HACA properties that are at risk of eviction when the moratorium is lifted. And we've contracted with a nonprofit, Civil Justice Incorporated, to provide counseling services, to legal services, to look at each person's situation and to help them prevent eviction, and also to connect them to county services. This is important because Anne Arundel County serves these residents through all of our health and human service and social service agencies, and we need to prevent the kind of humanitarian crisis that would take place if that many folks got evicted from public housing in our communities. tomorrow, the gun violence intervention team is holding its first community meeting. And I want to note that this work has been ongoing despite the pandemic, that that we had our gun violence prevention task force that did a report and recommended that we create, through the health department, a gun violence intervention team, which is multi-agency. So this is the first opportunity for that team to present its work to residents of the community and answer questions. And it's about prevention, education, local programming, crisis response. And we know that the numbers of shootings have increased during this pandemic, and that this is an area that we have to continue doing the hard work to try to push those numbers down with our law enforcement agencies and all of our agencies. Folks can register for that. You can go to the Department of Health or the Arundel County Facebook pages to get the registration information to log in. We also have our first of our new Interfaith Advisory Council meetings. This is an executive order that we passed to create a group of 19 faith leaders in the county who will meet on a regular basis and advise me and engage with county government to serve communities throughout the county. And that is on Wednesday at 6 p.m. And you can go to aacounty.org and look up Interfaith Advisory Council and get the information about logging in for that. Tonight is Few of the Many, which is a Black History Month, third annual event that we've organized in cooperation with the Caucus of African American Leaders. And we have a group of 19 residents who are not Black history of the past, but are making Black history today. And some of them are getting a Congressman Elijah Cummings Award and some a Sojourner Truth Award. And there will also be an interview that I conducted just a few days ago with Randy Curtis, who organized the 1,000 Men March in Annapolis, and another interview with Lynn Farrow, who's the Assistant City Manager of the City of Annapolis. And those were fascinating interviews that I hope people log into. So you can get to that through the County Executive Facebook page or Arundel TV cable stations. And then finally, a legislative update that Friday, the Arundel County delegation met and voted in support of two very important bills to the county. One is HB 933, which is an affordable housing trust fund authorizing bill for just our county. And it's essential part of our affordable housing strategy. We have 4 parts to it, and one is to create a housing trust fund to help to make projects that are affordable, new construction, workable in the county, as well as rental assistance, eviction prevention, and all kinds of assistance to meet the needs of the really 50% of our low and moderate income residents who are renters, who are cost burdened because of the cost of housing in our county. And then the Visit Annapolis bill, we call it the bill that just provides oversight to Visit Annapolis and Anne Arundel County, that allows the auditor. It's a continuation of our expansion of auditor oversight of all taxpayer funds. And so I want to thank all of the delegates who supported that. It still needs to get passed through the General Assembly, but generally when local courtesy, when a delegation supports a bill, the full body does so as well. And then next Tuesday night, we'll be doing a full update on the legislative session and all the bills that the county is following with Senator Sarah Elfreth, Delegate Sandy Bartlett, who lead the delegations respectively on the Senate and House side for the county, as well as Pete Barron and Hannah Dyer from our office. So a lot coming up, a lot going on, and I'll turn it back to you, Roz.
Thank you very much. Dr. Nilesh?
Thank you, Roz. Thank you, County Executive. As the County Executive noted, we are improving. So we are seeing a continuous improvement. Our case rate is down to 13.9. It's 14.1 this morning, so we're right at 14, down from 17 last week. Deaths are improving, which is critical. We're seeing that our hospitalizations are decreasing as well. And we've got a percent positivity that's coming down as well, 5.3%. We are seeing a lot less testing. So compared to about a month and a half ago, we're only seeing about half as much testing. So We are a little bit concerned that we may not be picking up some of those infections, but I think overall, with the decreasing hospitalizations, we're in pretty good shape. Still recommend that folks get tested if they have any concerns about exposure, travel, those sorts of issues. In terms of our vaccines, obviously, in our county, we've had 103,000 people who've been vaccinated, 70,000 first dose, 33,000 who've gotten their both doses. That represents 12.1% who've gotten the first dose, 5.7% who've gotten both doses. So a little over actually close to 18% who've had at least one dose. In terms of the health department, we've done 32,000 first doses. And then we actually, so a lot of questions about our shipments. We got our shipment last week, unlike many health departments. We were lucky. And we actually just got our shipment for this week in, I believe, just an hour ago, something like that. So we're on track for this week. As I mentioned, 32,000 first doses and 17,000 people have gotten their second doses through us. Continue to be in phase 1B, and we are particularly keyed in on the equity issue and making sure that we're getting those who have been disproportionately impacted during this. In terms of vaccinations in the county, are 10% of people who've been vaccinated are Black, 3% Hispanic, Asians 4%, and white 72%. And those lower numbers amongst Blacks and Hispanics are concerning because of the disproportionate impact this has had on them. So as county executive mentioned, we're going to be launching community sites sometime late next week. We're still working through the details. We'll have more on that once they get settled. The idea is very much to situate testing in the community and have community members active in recruiting for vaccination, in helping to operate vaccination. And make sure that we are improving those vaccination rates amongst Blacks and Hispanics and others who have been disproportionately affected. Along that line, we had a conversation with the ARC last week on vaccinating those with intellectual and developmental disabilities, making sure that we're reaching that community, which is well defined, and we're working through that. We've gotten a question. We are not putting a pre-registration category for that because it is actually a very well-defined category. So we're working with the service providers and with the Department of Aging and Disabilities to contact those folks and work through getting them vaccinated. We've actually, in the county, over 70% of those who are in group homes have already been vaccinated. So we're still want to obviously get the remaining 30%, but we're also keyed in on those who are receiving services in home or don't receive services, but are not in a congregate setting. We will also be continuing our community vaccinations for senior housing and independent living. Really, everything is based on vaccine availability. And so that we've got another couple of sites this week that we're going to. And then, as the county executive mentioned, within our pre-registration system, we're also expanding sites to Lewis Scott, South County, and O'Malley over in West County, just to make it that much more accessible, particularly as the state moves more and more into the mass vaccination sites. Our focus is really going to be on making sure that we are getting those who need the greatest help to get vaccinated. So addressing transportation issues, trust issues, and working with community members. And that'll be, while that is always important, we also want to make sure that equity is our primary focus in this. While speed is important, it can't be our only measure. And then the last thing I want to highlight is that we're getting a lot of questions, and understandably, about what people should do after they get vaccinated. The key here is that once you get vaccinated, you're in good shape. That's the whole point of getting vaccinated. But we need to make sure that while there's still a lot of people who haven't yet gotten vaccinated, that we're still protecting them as well. We're seeing new studies that are coming out that indicate that there's decreased transmission. So if you are vaccinated and you get infected, you're obviously going to fight it off. That's the whole point of the vaccine. And it's remarkably effective at preventing severe disease or death. But also that we're seeing decreased transmission, but decreased transmission isn't no transmission. So we still want people to wear masks. still try to avoid gatherings while we continue to vaccinate the general public, because we still need to protect each other. And once we get that critical mass of folks vaccinated, once supply frees up, that's when we'll really be in a better position to be able to decrease mask usage. So we're not quite there yet. And the best way to think of the masks after you got vaccinated is to protect others. And so with that, I'm going to turn it back over to you, Roz.
Thank you very much. Let's get started with Mike Brown from Arundel News.
All right, thank you. I'm going to go back to chat because I actually had a couple of my questions in here. How worried, and this is probably a question for Dr. K, how worried are you about these reduced number of tests? I've been looking at this at the county level and the state level, and this has been an ongoing issue across, not only in Anne Arundel County, but across the state. What is Anne Arundel County Health Department looking at doing to increasing seeing the number of tests? As you've mentioned, we may not be seeing everything, especially with now all 3 known variants, the Brazil, the UK, and the South African strand being in Maryland. What is the county health department doing to getting more people tested?
So that's a good question. In terms of testing, the reason we're seeing decreased testing is because once the case rates go down, fewer people perceive risk and are less inclined to get tested. So we did see an increase in testing as we saw the surge during the winter. And so we're going to continue to promote testing. We're going to continue to promote that through all of our channels. So it's not an issue of availability, Mike. It's an issue of people's perception. And you're right, with the variants, we do want people to be vigilant about their exposures and continue to get tested if they feel that they've been in any situation where they've been around others, either unmasked or potentially exposed.
Raj, you just want to go through my list of questions, or do you want to go round robin with everyone else?
Why don't you follow up with Ellen Jones, and let's take one question at a time. So okay, let's go to Fox 45, Amy Simpson. Amy, are you there? Okay, moving to Danielle O, the Capitol.
Hi, good morning. I have 2 questions. One is a quick one. Are the South and West County sites you mentioned going to be permanent going forward? So, and then the second one is the pie chart you showed with the MDH allocation doesn't seem on par with what they had previously told me, which is 6,500 doses, for all providers in Anne Arundel County a week. And, just doses to Giant does not really scale with what they have on the state website as the locations where you can get a vaccine in Anne Arundel County at pharmacies. So are there any more details around the allocation and where things are going?
That's all they gave us. And we hope that our residents are getting vaccinated at some of the mass vaccination sites too. So it's possible that they were including that in their number, but there are no vaccinations reserved for our residents at Six Flags or in Baltimore. But that's all they gave us.
And the 2 sites are permanent, yeah.
Okay, thank you.
Okay, next I'm going to ask Amy Simpson's question. She's having trouble with her audio. She'd like to know from the county executive about mass vaccination site in Anne Arundel County, what work is being done to make that happen.
A state mass vac. So I think asked about how we have the health department has put together plans for large sites when we have more vaccinations, and it's interesting. You know, I talked to my peers in the other counties, and we talked about this, that all of us, we just want our residents vaccinated. We don't care whether it's a state mass vaccination site or a county mass vaccination site, whoever has the doses. So I think all of us are in conversations with the state, as we are. We've requested, you know, mass vaccination sites, please come. So, but we have not heard that that we're at a certain place on the list in competing for those sites. We just we've let them know that we have sites available that are ready to go. You know, including I think the one that most people know about that's the largest would be Navy Stadium, but we haven't heard anything that tells us that there's any timeline for that or how they're making those decisions.
Let's go next to John Frenaye, followed by Brooks DeBose. John?
I guess this is for the county executive or possibly the health officer. Do we know what the uptake on getting the vaccines is for our first responders? I've heard from all over the country that the uptake is pretty low. Like in DeKalb County, Georgia, it's 18%. The city of Atlanta is 50%. Do we know how many of our first responders, as far as a percentage or a number, have actually had the vaccine?
We do. I don't have the number. We can get it to you. Higher than what you were talking about from these other locations is what I remember hearing, but we can get back to you with numbers.
Thank you.
Brooks?
Hi, two questions for the county executive. Sorry, this is Brooks DeBose with the Capital Gazette. The first one is this morning, the city of Annapolis announced that they had filed a lawsuit against 26 oil and gas companies for their role in climate change and worsening climate change. So my question is, are you considering similar litigation in the county, or even maybe just joining the city in that litigation, given that the county has significant coastline, including the city of Annapolis?
Yeah, we actually are. And they have a specific case that's specific to the city of Annapolis because of the impacts of climate change on the city and their infrastructure. We have other locations in the county, as you know, 530 miles of coast. So we are in fact planning to file a case as well, same law firm, similar kind of a case, but it's a separate case.
Thanks. And then secondly was a follow-up to your announcement about helping the HACA residents in Annapolis. When does that start? If it has started already, what does it kind of look like? I can also follow up with the ACDS, but just wanted to get a little more detail on what that looks like.
Yeah, I think you should follow up with them. It has not started though. It's a contract that it came out of really hearing about the numbers of people who were at risk and asking if there's anything that we could do. So, Kathy Koch at ACDS and Pam Jordan, our Deputy CEO for Health and Human Services, approached HACA and wanted to make sure that they were comfortable with and would cooperate with a program like this. And they said, yes, absolutely. I also was contacted by Alderman Gay in Annapolis about whether the county could help in some way. And this is what we put together. So there's going to be an outreach effort connected to this. It's going to require, door-to-door work and building trust in the community and working through case by case, each person's situation to try to prevent the eviction from happening.
Thank you.
Kathy Koch is with us. Kathy, do you care to add anything?
No, that was very good. Our county executive did a great job in explaining that, and we will be putting out a big announcement real soon, and we'll be doing the door-to-door connections. And I'll be happy to follow up with any other questions you may have.
Thanks, Kathy. Is there anything else? I don't have any other questions in the chat. Anything further? All right. Thanks very much, everyone, for joining us.